Let's do this. Welcome back to the Many Minds podcast, where we encourage collaborative community healthcare using many minds for better outcomes. I'm Alex Davis, physician assistant. Got with me, always next to me on the couch, Tyler Murray, nurse practitioner, and the two of us work together at Summit Brain, Spine, and Orthopedics in Lehigh, Utah. The purpose of the podcast, the reason we're here, is to integrate and collaborate and get to know who else is out there and what you're doing. Specifically, advanced practitioners is who we're talking to. What does your space look like? What makes your specialty special? What are the challenges you face? And how can we ultimately help each other to provide better patient care?
And as always, we want to start with our general disclaimer. This podcast represents the opinions of myself, Alex, and any guests that we have on the show. The content from this podcast is not meant to act as a substitute for professional medical advice, diagnosis, or treatment. We're just here to chat and have a good time. And with that, we're going to introduce the lovely, wonderful Miss Whitney.
Thank you.
She is she's in neurosurgery as a nurse practitioner, been practicing for quite some time. Well, a year.
Yeah, a little over a year.
That's right.
Yeah,
so you're kind of getting your feet wet as we discussed.
Yes.
So we're happy to have you. I guess I thought that because we've been friends for so long.
Yes, well, I've
and
known
worked
you
as a nurse
for like so long. Exactly.
Yeah, I love it. In fact, we went to UVU.
Yes.
And you were the cohort behind me?
Yeah, I think so. Yeah, because I remember when you charged up on 4.
Yes. Yeah.
I tried to get a drop up there. Did you know that?
Well,
we could have
didn't talk to the right people. I would have got you in.
I know.
No, I wasn't that important actually. So
I'm excited to hear then what kind of dirt she's got on you.
Oh man,
you guys got to work together as nurses.
I know, you're right. So we're gonna have him to make up some stories.
Okay,
Yeah.
that's true.
We don't need to go there just yet.
He's too loved, so I'm gonna bring it down a little bit.
You got to knock him down a peg or two once in a while.
This guy does it all the time.
So I have to do with my coworker.
Look historically,
I'm like, you
all
look
the
so
time.
good. I'm just gonna be making up some story.
Oh, but I digress. So neurosurgery is the kind of the topic of today.
Yeah,
and
kind of
obviously resonates with us really well because that's our space. So we're excited to have you. I think to start us out, maybe you just give us a little background, kind of how you got into neurosurgery and a little bit about yourself.
Okay, great. I was going to say, I'm going to tell you guys this podcast is great. I'm glad that you guys have found, the hole in the podcast world for people like PAs and NPs. And I think you guys are doing an awesome job. I'm learning a lot.
Appreciate the love.
I'm loving it. So
I guess Whitney said, I guess we'll keep doing it then.
Yeah, okay, great.
I told this guy, I said, you know what, at the end of the day, if we don't have a lot of followers, that's okay. It's been so good for us.
It really is like so awesome.
Connecting with the community.
Like me and Tim were talking about it in the OR. He's like, I'm learning so much. And I'm like, that's an equipment rep. Like we're all learning so much, which is awesome.
That's awesome.
It is. It's good. Hopefully people get something out of it.
I appreciate the feedback. That's great.
Yes, no, seriously. So yeah, I'm Whitney. I have been a nurse practitioner over a year now, and which is so good to say. Feels so good to have, made it.
Happy anniversary.
Thank you so much.
But
I was a nurse for like 9 years before that. I started on progressive care. Do you remember progressive care unit?
Yes, I do.
That I was there for 3 years. It was seriously like the best time of my whole life. I'm like, life does not get better than PCU. It was like a 16-bed unit. I worked with London, who you had on last week.
Yeah.
So it was just like the best time. Anyway, so it was a step-down ICU, and then after 3 years, I went to ICU for, I guess, 6 years, which was, I never even imagined I'd be in ICU. That felt like so far away from anything that I would have known, done, anything. And yeah, then the pandemic happened. It was a rough 2 years, and I was like, I gotta get out. So I went to NP school and kind of landed in neurosurgery because I did neurotrauma mostly in the ICU. So just kind of
crossed over well.
Yeah. I didn't cross over as well as I thought.
Let's back up a minute. There was a transition.
Yeah, there's a transition. I'm like, turns out critical care did not carry over to NP world as well.
You know what's funny about that?
Yeah.
I would have thought the opposite, honestly.
Yeah, no.
I worked on the neurosurgery floor. Then I transitioned, and that was the only unit I really worked for.
Yeah.
I mean, neurosurgery, orthopedics, we did a little neurology, and then urology, which was crazy, but how they decided to connect those two together.
Your transition from that was like so much more helpful than like ICU.
A little bit, but I realized as a bedside nurse, I never looked at scans. So then I transitioned into this provider role, and Dr. Edwards is like, look at the scan, tell me what you think. I'm like, I have no idea what I'm looking at.
See some bones in there.
Yeah.
I think that's a nerve.
Well, unless they have
Is that a T-bone steak?
Let's say the big infarct. I don't really know.
But that's honest. So there is that transition, no matter how much you learn, but the foundational knowledge that I'm sure you acquired helped in many ways that maybe weren't recognized at the time. But
I know. I even think like when I went to 7th and discharged somebody, I was like, I don't really know. Like, you guys are all healthy. I feel like you're doing good.
You're
doing great.
See
like,
the patient's eye.
Yeah, you get out there. I don't know. Be careful. Like,
I love that.
I just was like, it's been a transition because then, if there's an emergency in the OR, like that's the anesthesia's job. Like, I don't have emergencies, in clinic. So it's just kind of interesting how I would have thought.
Yeah.
It did help for sure, but just not as much as I would have.
There's a learning curve.
A little bit of a different space for sure.
For sure.
I'm interested. I didn't actually realize this, that you were in the ICU during the pandemic and the COVID thing. Tell me about that experience, because that was an area that got hit hard and you guys got...
How much time do you have? Seriously. I'm like, I can feel my pulse
Is this
rising.
a counseling session?
Yeah. I'm like,
Sorry to
just got the tissue.
bring up old wounds here.
I know. No, it's fine. No, but truly, I would not have gone to NP school if it wasn't for the pandemic.
Really?
Yeah, because as people know, it was a little rough in the ICU, and I worked at Utah Valley, and it just felt. It was 2021 was a rough year. Like, I just felt like everybody was sick, everybody was not doing well, passing away, and it just kind of felt like healthcare was on this trajectory of like, I'm like, we're never gonna. Like, it's never going to be the same. We're never going to come out of this. I'm like, this skill set, I was glad I had the skill set to help in the pandemic, but at the same time, I'm like, it's too much, like going to work every day and having it be so heavy. And anyway, so I just was like, I got to get out and do NP school. And I didn't ever really know what I was going to do other than I'm like, that'll help me out of the ICU. So, it was a rough time. It was.
On a more positive note, though, you did travel, didn't you? You went and helped other facilities.
I actually did not.
You didn't?
I stayed just
there was a camp out that were doing. Okay.
So many people did. I think that was the hard part, is that I felt just so compelled to stay for our community.
I love
and
that.
Just like, it just felt like everyone was so short-staffed. We had travel nurses. Like, our doctors were like, we need our staff that knows. It's hard to go to a new hospital and not know where things are.
The routines and the people.
Exactly. So
interesting.
Yeah, it was. Yeah, all those poor new graduate RNs that had to come in and just got thrown in. They were sick patients. Like, those were
And it wasn't
times.
just a couple beds. You had the entire unit overfilling, overfull.
Yes.
Overfilled.
I know. Yeah. It was like kind of funny. Like, I remember when the pandemic first started, it was like actually some good memories, because half the unit was closed, like behind the doors, and that was COVID, and it was like all the young nurses, we were all together. We're just kind of like, it's like the Wild West behind these doors. And
you have to band together.
I know.
Yes.
And I was like,
interesting.
As hard of a time it was, I'm like, wow, we all like grew together. We learned to like work together well. And it was like good memories in there too as well, for sure.
I love that.
So,
well, tell us about your day-to-day now. So you went from nursing, we transitioned, and you elevated and moved on, and now as a nurse practitioner in neurosurgery, what's your day-to-day look like now?
My day-to-day is I do clinic twice a week. Well, I guess clinic 3 times a week, and then I operate twice a week. So and then I'm there. We do call every once a month, a week of call, and then I round some weekends. So it's feels like a lot, but it's been good. So
a little difference between your setting and ours would be that you're currently employed by the hospital. Is that correct?
Yes.
And so where we're an independent practice, there is some differences there. And the one question that I had is, are you assigned to one neurosurgeon, or do you kind of rotate and help the masses, if you will?
I mostly am with Dr. Brock. She's my surgeon. That being said, I sometimes help out the other surgeons. They're one of our older surgeons. I operated with him for once a week until he retired. So, and then I help out the other 2 occasionally. But mostly Dr. Brock. So
shout out to Dr. Brock as well. We know her. We love her. She's fantastic.
You guys know her. Yeah,
absolutely.
So it's kind of fun.
We love Dr. Brock.
Yeah. So I know you guys have been helpful.
Ask her how she felt having me assist her in the OR. All right.
She freaking loves you guys. Are you kidding me? She's like,
she was always so patient and willing to teach, and she's awesome.
She's so honestly, she's been patient with me, so it's fine.
She's awesome though.
I
So
know.
yeah, definitely shout out to
Seriously.
Dr. Brock.
We had a fun trip to Philadelphia. I think we've mentioned that in the
Yeah,
past.
We
you really
bonded.
did.
Yeah.
Which is so fun.
It was just the three of us, just Tyler and I and Dr.
Oh,
Brock.
Was it just
We had a
the
good time.
three
It
of
was
you?
just the three of us. Yeah, we had a
That's
good time.
Yeah, she's great.
I lost my
so-
wallet. Tyler missed the plane.
You missed
It was
There was a whole thing. Yeah.
All right, real quick. We were getting onto the plane, and the overcom thing was telling us that all the overhead bins were full.
Yeah.
And so they were saying we have to check the bag. So right as I'm about to get onto the plane, I see this guy in the orange vest, and I'm like, are we supposed to check our bag? And he's like, yeah. So he takes my bag.
Yeah.
And I'm on the plane, we're taking off, and I'm thinking, he never marked my bag. How does he know where my bag is going to? Because it was just we
He
were
just
going to
took
get
your
onto another
bag?
plane.
We had a connecting flight.
A connecting flight, thank you. And anyway, so I'm in midair, I'm talking to the stewardess, she's like, oh no, that's bad.
Your bag's gone. You'll never see that again.
I'm going to try to make this short, but at the next stop, which was O'Hare, right?
I think in Chicago. That sounds
Chicago
right.
O'Hare.
Yeah.
They let me into the baggage area. I'm seeing this whole conveyor belt system of
Wow.
bags, and they're like, yeah, see if you can find
Did you
your
just
bag.
like pick a new bag?
I'm like, I can
Pick your
a
favorite.
sea of black bags. I'm like, I don't know
Pick
which
the
one's mine.
nicest one.
Yeah. So anyway, long story short, I got out of security at the Chicago O'Hare International Airport, and then
Yeah.
I had to try to get back through security to get to the connecting flight.
Oh,
and these guys are calling me, and they're like, hey, we're boarding right now. And then Alex sends me a text, you got 2 minutes. I literally seen the first pilot coming off, and I'm like, where is terminal this? And he's like, oh, buddy.
Get on your horse.
All the way down that way, all the way down that way.
Hope
He's
you
like,
can run.
he's like, run. I literally ran. I had cotton mouth.
Oh.
The doors are closed by the time I get there. There's a little
They didn't
desk
let you
behind.
on?
They had taken off. They had
Did you
taxied
find
rather.
your bag at least?
So whole story. Yes, I did find my
Okay,
bag.
I was like,
It was
how
found.
bad would it have been if you missed the flight and didn't find your bag?
But it
Yeah.
was just that was the
And
wildest time.
I
And
think
Dr.
about that.
Brock
I know.
had-
She thinks she's babysitting these two kids this whole trip. We can't take care of ourselves.
Oh my! The best part is, I feel like that's like totally. Like, she's just like
She
yes.
rolled with
Shaking
it.
her head the whole time.
She rolled with it. She's
I
like,
would tell
well,
her, I'm like, you are the good rule follower. You keep us in line.
Yeah.
The rest of us.
the airport system did make up for it all. The person literally hand delivered it to my house. Like
You're
brought it
kidding.
to my house front door. It was awesome.
That is service I've never seen from an airline.
Service, yep. But it was a stressful time.
No kidding.
I had to tell that story.
No, I'm
I
glad.
love
I
it.
appreciate that. I actually
because it
do
does
appreciate
incorporate
that.
Dr. Brock. So
It does. We love her. It's so
Yeah.
it's so great.
So when you first started,
Yeah.
what was your expectation? Did you feel like it was pretty laid out for you what you were going to be doing as far as how much you were going to be in clinic, how much you were going to be in the OR?
Yeah, yes and no. I think I severely underestimated. I mean, people always tell you like transitioning from an RN to an NP is so much harder than going from just like off the street to RN. Like, and I knew that. I'd heard that. Everyone had said that. I severely underestimated the training that it would take. I felt like, so if anything, I probably spent more time, like I went to the OR anytime possible, like with any surgeon like that we worked with, just to get the experience. I would shadow my other like NP coworker Kyle, and I felt like I was like doing a lot just to try and like keep up and like learn,
There's a lot of expectation when you cross over into the provider
and then
world.
you're
like,
the provider, right?
people are
So it's
like, yeah, you should know what you're doing.
Yes. I'm like, oh my gosh, you're like in the room with patients and you're like, here's the scan, there's some stuff going on. Like, it's just like, it's just like a lot. Like, till you start learning things and clicking, it's stressful. So I feel like I worked a lot in the beginning because of that. But I think the hardest part was the transition to the OR. I'd been to the OR
a whole nother world.
one time. As an ICU nurse, you learn like the OR doesn't like you. It's a scary place. Like I'm
Don't
always
go there.
Yeah, like it's just, you don't go there. You don't go to the second floor. And so I was just like, what is happening? I was like, everyone had to watch me so that I didn't break sterile fill. You just don't realize everywhere you turn, everywhere you look, you have to be so careful. So that was probably the hardest part of my transition was
The OR.
The OR.
Mhm.
Yeah.
Absolutely.
And then I think what surprised me is clinic was a lot better than I thought. Like you kind of hear like the surgeons don't love clinic. That's why, the MPs are there and, they want to be operating. And so I actually have really loved being in clinic with patients. I'm too chatty. I'm always behind, but it's been fun. I'm like, this is fun that you're like my patients. I get to see you get better. I get to like get to know you, and it's just that's actually been the easier part than I would have thought.
I love that.
Yeah.
I love that.
Yeah, I could get a sense from that. You seem like you're easy to talk to, obviously.
Half the time I'm like, have
high
we
energy.
even addressed the issue?
Yeah.
Like,
what were we talking about?
My MA will come in. I'm like, oh, we haven't even gotten to like the point yet. Sorry.
That's good though. You're connecting with people.
Yeah, that's actually been really fun. Like
I
have some really, really nice patients for sure.
That's
yeah.
awesome.
And it sounds like a lot of autonomy in the clinic. You're kind of running your own clinic with your own patients.
Yeah.
And then are you referring to, again, specifically to Dr. Brock? Are you open to refer to any of the surgeons in your group? Or how does that situation work being employed?
We mostly everything goes to Dr. Brock, but like there are certain things that, that like Dr. Bevan, he does a lot of like our pituitary stuff. And so things like that, or like Dr. Wad does all the endovascular things. So yes, specifically they have each of their own specialties within neurosurgery. So, or, like I said, I've sent stuff up to you guys or other surgeons or up to IMED. So yeah, everyone has their own things. So I feel like mostly Brock, but I send stuff to a lot of other people as well.
What's your patient load like? How many are you seeing in a day? Do you feel like it's manageable?
Yeah. Okay. Well, I'm like too chatty. So yes, like it's manageable, but there are like 2 other NPs that are in a clinic that they crank out like 20 patients a day. And I'm like, how do you do that? But I probably see like 12, 13, which is for me, that's a lot for me. But that's probably an average day.
That's where I was at that point as well. It's very similar.
Yeah. And those new patients, I feel like you kind of like really have a lot to like, dig into, get to know. So yeah, that's probably an average day. So to me, it feels like,
it's a full day's of work.
It's a full day work, but so it's getting easier. I'm getting more efficient, figuring out the right questions, trying to not, be as chatty. But so
I'm sure people love it though.
I bet they eat that.
That's part of the job.
I don't know. Well, we'll see. But it keeps me busy for sure.
Yeah, that's always the shout out to the advanced practitioners, because that's part of the job is the personal touch.
Yes.
Getting to know the people personally.
Yeah.
To where sometimes a specialist physician or a surgeon has a unique skill set where they can only provide, they're the only ones that can provide the service of a surgical intervention. And that's where they're best suited to be, is in the operating room.
For sure.
But I can't do a surgery. No. But I can spend some time and chat with people and make them feel comfortable and ease some nerves. And so
exactly.
I think you're doing the right thing. It sounds like you're taking good care of people.
Thank you. My favorite is when patients are like, so like you're doing the surgery? I'm like, oh, no. Like, no, I am not.
I'm here for entertainment.
Yeah, I'm here for entertainment. I am there assisting and being a good supportive role to you. Like, no. So yeah, I love when patients say that. No, I won't be there removing your tumor. Thank you.
Yeah.
But I appreciate the vote of confidence.
Yeah,
that's very
I know.
nice
Seriously,
of you.
I love the Dr. Whitney. I'm like, that's cute.
Yeah.
No.
I love that.
Oh man.
Maybe switching gears a little bit. I want to jump into pay scale a little bit.
Yeah.
Your expectations coming in as an advanced practitioner, I mean, obviously working as a nurse, we kind of know that our expectations are there just because you can actually make quite a bit of money. And especially during the pandemic when there was a lot of need and they were offering so many incentives. But kind of walk me through that. What were your expectations? Kind of where are you at in the pay scale? Do you feel like you're competitive amongst your peers in that regard?
So it's a funny question. I'm like, I feel like, do any of us feel like we get paid enough?
No.
Like, I'm like,
the answer is no.
Blatant statement. I'm like, I feel like I'm like, none of us. Like, even, I mean, you even talk to the surgeons and they're like, I'm like, even in their like realms, like, none of us feel like we get paid enough. I will say that, I get paid fine, but as coming off the heels of the pandemic, I will say I was like, it's like a little bit equal. So
it's crazy.
It is kind of crazy. So I think like getting to the NP world, you look at the long game, right? Like I feel like if anything, it wasn't a huge pay raise, but I think over time it will be for sure. I get overtime, so that's where
nice.
Yeah. What is your pay structure? Is it just salaried?
So it's salary, and then it's salary. And I the first thing I asked was I will never take the job unless there is overtime, because as we know, specialties are, some
you're working more than
some. Yes, exactly. And so some of the other jobs I was looking at, it would have been 3 days a week or like 5 days a week, where this is it's not all the time, but it's I needed to make sure I was like, we need overtime.
You got to be protected that way. Yeah,
exactly. So yes, I get salary, overtime. And then what's unique about my job is I'm on call. So once a month, 7 days a week, I have to be within, 20, 30 minutes of the hospital, 7 days a week, 24 hours a day. And that's probably where I'm like, oh, I wish I was compensated a little differently, but, we're working on that. So...
Well, that's good. You're having those conversations.
Things, yes, exactly. So
and I think if they're willing to have that with you, I think that's important.
Yeah. So I think that's like always my advice with people that are looking at jobs is like definitely look into the overtime since you're like salary, because that's new. Like as RNs, you're just like, it's
hourly shifts.
It's hourly shifts, right? So if you stay longer, but that was like one of my concerns with.
It's a little defeating because we just got out of a rounds discussion and one of the surgeons just mentioned how Medicare reimbursement rates are actually trending down.
Set up the new guidelines for 2025.
Really?
Yeah, so it's going to hit the whole medical system.
I know.
But it's unfortunate to see because it affects so many of us. And like you alluded to, it's like we put in what we believe to be really hard work. We want to give quality care. We want to give the best care. But we also want to be compensated. We have families of our own we want to take care of. So I think this is an ongoing conversation, and I don't bring it up to try to there's no agenda here other than just talking about it, so there's some transparency across the board for advanced practitioners, like how much are you being compensated for what you do, and do you feel like it's adequate, and what types of conversations can we have to make those changes.
Absolutely.
So that's maybe more on a real note, but it's real life. Like these are things that are important to us.
They are. I mean, because that's when you go and get an advanced degree, that the hope is that it's worth your time.
You're moving up the ladder.
Right, exactly. Which, yes, I think definitely, for sure. But I feel like at the beginning, you're kind of like, oh no, what have I done? Because I'm used to my, working 3 days. I can pick up an extra here. I know, do you remember those days?
Oh my gosh.
Those were nice days, right? I was like, oh, wow, I just had, now I'm like, how do people get anything done? Like, how do they go to the dentist? Like, how do they get their oil changed in their car? Because I'm like, I'm not used to this,
so with that, do you have PTO? Is that built into your...
Yes.
That's what I was going to get as the other structures of it, because you're part of a big corporation, right? This is a big company.
Which there are huge pros to that. There are cons, but I will say that it is actually... now that I'm in the NP world, I'm learning the difference between private practice and working for corporations. And as you guys know, there are definitely pros and cons to each, for sure. So working for a corporation, yes, I get PTO, I get good benefits. That's kind of what kept me at Intermountain, was all of that. I have a pension, all those kinds of things.
I walked away from that pension.
I know, it's fine. It's fine. Yeah, I know it's good.
Daggers.
But yeah, so there are so much more to even than just pay. There's a lot more like benefits and all those things wrapped in.
Yeah, and there's a lot of security when you're working for a big organization.
Right, exactly. Yeah.
They don't want to see you fail. You don't want to see them fail. So it's a mutual thing.
Yeah, exactly.
That's good.
Loan reimbursement as well.
Oh yeah. So yes, they did. You're right. That's a huge thing. So when I was in RN, they paid for, I don't know, we'll call a third of my master's, which was awesome.
Yeah.
Yeah. So
as long as you were full time, right?
And then is there like a trade off where you're contracted for so many years or something like that?
They had tiers, so you could take just the first tier is you can take partial loan reimbursement, and then if you left, you wouldn't pay that back. But then there was another tier, which I did, and it was 2-year commitment after that. And so that's what I did. And I was like, I'll probably stay with Intermountain. They're pretty competitive with pay around, and they actually gave me the best offer. So I stayed, and so I signed a 2-year contract, I guess, for my loan reimbursement, which was well worth it for sure.
And then as far as pay structure, is yours the same across the board, or is it subdivided by specialty, if that makes sense?
Yeah, that's the controversy. Yeah, I think through the grapevine, there are some differences in different specialties as well, for sure. Right. So I'm not at the top. Yeah, there are other specialties that are in different pay tiers, for sure.
Room to grow?
I think so. I mean, it's always an ongoing conversation, but definitely. Good. Yeah, for sure.
That.
How about the flip side of that is always people argue one side of the coin is the pay scale and how much revenue and how much reimbursement you're getting, and the other flip side that you guys, it sound like we're alluding to, is the time off and balance with family and things like that. How's your balance right now?
Yeah, it's good. It's getting a lot better. I feel like the first couple months but I kind of put it on myself to learn and be
involved,
being as involved as possible, because I just felt like I feel like I want to learn everything and do the best. I come from the ICU world where type A, we want everything it's funny. Like, I feel like I'll ask questions and things, and I get the answer. Like, it's a joke now. It's like, it depends. And I'm like, I hate that answer. I hate that answer.
Yeah.
I'm like, I want like a protocol. I want things to follow. Like, I'm like, just like we come from this, like, I just come from this type A world.
If this, then that.
Yes, exactly. And I'm always like, Brock's always like, well, in this scenario, and I'm like, oh my gosh, like, I just want clean answers. But no, I've learned. So like, now that I'm kind of learning more, I'm like, okay, I can see all those things. So I felt like in the beginning, I was like working myself to death just to, I don't know, just make sure I was caught up.
Sure,
and,
yeah.
You know, I also,
standard,
there's a stress of like when a patient's now getting in with a neurosurgery office, I'm like, I want them to have a good experience. Like, it's not easy to get into specialties, and I don't want them to like come in and be like, you have no idea what
and
you're
it's
talking
different
about.
when you're carrying out the plan as a nurse versus making the plan. Like, there's a sense of responsibility there, and that definitely is part of that transition.
Yes, I'm like, I want my patients to feel like this was worth their time, their visit. And so, that's been so much better. Like, actually being like, okay, I can think through and like a plan and help them and talk with them about things. So much better work-life balance now, for sure. Yes.
Good. I think everybody finds that kind of sweet spot eventually.
Yes.
How can we support you then? The community at large, referring providers or collaborating providers, how can we support what you're doing?
You two are the best. I mean, we gotta let the podcast know. You guys have been there through some times. You guys have talked to me, you guys have been there so nice.
We got each other's back.
Of course. I think that's also something that I severely underestimated, was relationships in healthcare. Like, as a nurse, yes, you interact and you see a lot of different specialties, but man, being an NP and having those resources, those people, those relationships, it is huge. So I feel like
make or break,
it really is. Like, I mean, I'm making phone calls every day to other specialties, especially pain clinics. Like, these pain doctors, bless their hearts, I am calling them so many times a day. Like, you know what I mean? Just to be like, is this okay? Do we feel like this is a good plan? So I feel like that's been the best part, is like that I feel like the community has been so helpful and so kind, and it's been, regardless of where you work, private practice or not, like, I feel like the people just want everyone to succeed and like do well, and like, I feel like we're all kind of like helping each other out.
Well, that's what we found is lacking in medicine, is this collaborative care. And so for you to be reaching out to these pain clinics, I can only imagine that they're embracing that. That's exactly what they want. Been so good and that's what the patient wants. Yeah. And so that's what we want to give.
Plus, like, on the other side, like, there were so many things. I'm like, I was laughing when you guys were talking about the EMGs. Like, I had no idea what that was. So like, I went over to, Utah Valley Pain, or neurology, and I was like, what's an EMG? And like, it's just kind of,
through it.
Now I can tell patients like what it's like. I've seen ablations, I've seen all the like, spinal injection procedures. So it's helpful to have seen it, to be able to like explain it.
It's the same thing when you go into the OR. When you go into the OR and you see it, then you can come back into clinic and be like, okay, I can really break this down for you.
Yes, exactly.
In a way that's digestible.
Exactly.
So that's super helpful.
Yeah.
Helps us to be more well-rounded. And
exactly.
That's our goal.
And I can be like, oh, your provider is going to be awesome. They're so nice. They're so helpful.
Yeah.
Like, that's been,
I love that.
So, yeah.
What are the right type of patients that we can send over to you guys? What's the ideal scenario?
Ideal scenario.
The ideal scenario, or
here it is, the grill time.
You've got a family practice physician, or you've got a neurologist, or you've got somebody in the community that has a patient they're working with. What's the appropriate time and the appropriate scenario, or when are we sending people to you?
Okay, I feel like that's such a loaded question, because part of me is like, just send them over.
It depends.
Like, it depends.
It depends. You did it. Oh, come on.
It depends. Yeah. That feels so good to be the one to say it.
Yes.
It depends.
We just had a moment. Breakthrough moment.
I feel like my surgeons are gonna be like, oh, see, you get it now.
Yeah.
I feel like I'm like always like, for like, just like, I always tell providers, I'm like, send me a text, let me know what I can do to help. I feel like the ideal patient is just like, hey, we got some scans, like an MRI of like your back, brain, and like we kind of take it from there. But I feel like the ones that have started PT, that's always great to get that going. Some have already had injections, which I'm like, wow, that's like above and beyond. But I kind of feel like once the scans take place and they've done some physical therapy, that's when we like take over. So yeah, I'm like, that's
pretty open door. I like that.
Yeah,
though.
I mean, I will say it's like pretty open door. It really is. Because I'm like, that's fine. Like, I get patients where I'm like, we'll just work them up. Like, I get the scans done. So it kind of just depends on their symptoms, how severe they are. those herniated disc patients, man, they like want to get in. They want to get going. So it kind of just, it
Are you guys pretty accessible to the community?
Yeah, totally. I would say for sure. We keep some open slots in the morning to see patients that need to get in quickly. I stay sometimes a few slots like later after the end of my day to see patients. I've left the OR to go see patients as well, like just to fit the emergency ones in. So yeah, we're pretty open and accessible. Yeah.
And that's a helpful thing in your guys' scenario, because your clinic, your outpatient clinic, is attached to the hospital where you're operating. So your group of providers never really stray too far from home base.
No,
so everybody's
that's actually
pretty accessible.
really nice. Yeah, it's really nice for sure in that scenario that I can run over, run back.
Yeah.
I can run out to go see patients. Like even last night I was operating and, I ran down to the ER to see, because we were on call, and so ran down to see a patient, looked at the head scan, scrubbed back in. So it's nice to have our position, because we can be a little bit more
fungible, a little bit more.
Yes, exactly.
Accessible. Mm-hmm. That's awesome.
Yeah.
This is kind of a fun topic we like to bring up.
Yeah.
You said you've listened before.
I have.
You should know what's coming.
Oh, no.
Something trendy or new or different, or what's kind of the exciting thing in your world right now?
The exciting, I know, I was like, we were just talking about this. I'm like, what is, okay, I feel like I would say, it's all new and trendy and fun to me.
It's all new. Trendy.
Even all the things I'm like, this is so cool. And they're like, this has been around for like 70 years. Cool. But I would say what impresses me is probably all our minimally invasive things. So because I worked very closely with a surgeon that has just retired, it was very interesting to see, just how things advance and grow over time. So the minimally invasive procedures, you guys
familiar with it. We are, but not everybody is.
Yes. And it's like crazy what we can do through, a tube this big, and then like you have an incision the size of your pinky, and it's pretty remarkable. Like I'm like, wow, like we just did everything through that tiny tube. Like we can do discectomies. We've extended fusions. We can do, just all kinds of things through minimally invasive procedures. And I think what's cool about Dr. Brock is she is so meticulous and so detailed that it's really cool to see just, everything get done through just a very, very small incision. And
and patients do well, and that's probably a unique perspective. They do well after surgery. A little bit less disruptive. I think we're still getting great outcomes and and appropriate surgery times and all of the things I think are on par with the highest quality of care.
So I think the minimally invasive stuff is really cool to me, and then the endoscopic stuff, like a lot of things can be done endoscopically, and that's really cool. Spinal cord stimulators, that's something that we do a lot, and we were talking before, like how they're advancing in their technology.
They can take the place of some of these otherwise would be big operations.
Huge,
where the risk isn't so much. The risk is higher than the reward, right? And so you worry about those types of patients. So you have other alternative modalities to extend to them to manage their pain, help them improve their functional status. That's the ultimate goal. We're trying to be as minimally invasive. In the spine world, we always say less is more. And we should always hold to that, because with the best intentions in mind, you can do a procedure and a patient can have complications. And so minimizing that to the best of our ability is the most appropriate approach.
And I think people don't understand that as well. Like I spend a third of my day trying to undo, I don't know if you guys have the same issues, but undoing the reputation of neurosurgeons.
I was just going to bring something.
Literally, I feel like people are like, oh, I had a friend, they got a fusion, and then it's just like all of a sudden it's their whole spine.
Their life's over.
Their life's over, and they haven't done as well.
The domino.
And I'm like, it's crazy how much I'm like trying to undo that narrative where I'm like, yes, there's
a time and a place for everything.
Exactly.
And the wrong time, the wrong place, it's not going to go well.
I just want surgery now. And I'm like, just be patient. I'm like, a lot of this we can fix without surgery.
You got to kind of correct both ends of the spectrum.
I'm like, let's kick this can down the road. Let's try and control things. And I've actually been surprised. People will come in with these huge herniated discs and get an injection done and do well. I've even been surprised where I'm like, you're coming back and we're doing surgery. And they're like, no, I'm doing fine.
100%.
So it's, like
I just had a physical therapist this morning talk to me about a patient. I referred over to him and was talking about how he had a large herniated disc, and he's done physical therapy and he's feeling so much better. He's back in the gym lifting.
Yeah, see how awesome
I mean,
is that?
we underappreciate the amount of back injuries that occur that don't require surgery. Like,
seriously though, it's so true.
We just need to buy into these alternative modalities. So the takeaway there.
Yeah, it's just, so I feel like that's what's cool is talking to these patients a lot. Some of them don't believe me. They're like, yeah, right. But I'm like, no, truly, we can do a lot, conservatively before surgery.
Validate for you.
Yeah,
I was wanting to know if it was a similar experience, and it sounds very similar that we'll either get people coming to the office and the only thing on their mind is fusion is the only option in the world of neurosurgery, and they're deathly afraid of it, and they got forced to come to the clinic and they don't want to talk about fusion. Or it's the other patient who does not need any surgical intervention and they're dead set on, when's my surgery day? Get me schedule. I need a surgery right away.
I was having surgery. I'm like, oh my gosh, we can fix this, no problem, without surgery.
That's probably the two ends of the spectrum. I wish we could kind of realign that a little bit.
One of the approaches that I've done is always go into it trying to convince yourself why the person doesn't need surgery.
Agreed.
And then if you do that and you can't prove yourself as to why they don't need surgery, then surgery is probably appropriate here.
Right. And I feel like I always tell patients, like, it's been nice to follow so many providers to get kind of what they say, but I'm like, why, like, surgery has its risks. So I tell people, I'm like, it's not benign, right? So why not, by the time you get surgery, feel good about it? Like, don't you want to look back? If there's a complication, don't you want to look back and be like, I did everything I could before surgery, and now I feel good about, I don't want to look back
taking the risk of
taking the risk of it.
Yeah.
Not that there are many, complications, but surgery has, nothing's benign in the surgical world.
That's exactly
So I'm like, it's good to, take a second and be like, okay, I don't want to just jump into things. I want to feel good. And I've exhausted every option.
I love that.
So,
that's awesome.
Yeah.
Well, this has been a lot of fun.
Yeah, guys, this has been fun. Thanks for having me on. I feel like we could sit and chat for ever, especially about neurosurgery.
It's too easy.
It's too easy. Seriously.
It's too easy.
I love this. I think we've had a couple fun stories, but that's usually what we finish up with is some story time. Is there any fun patient experience?
My gosh.
Any fun, memorable thing you'd want to share?
Yeah, I know. I was thinking, I'm like, what? Good. Because I feel like working in healthcare, I used to end the day, me and one of the doctors used to be like, you can't make this up.
Yeah, exactly.
You can't make this up. If I told people what happened inside these walls, you'd be like, what? I was laughing though. So I was in the OR yesterday thinking about past experiences, and one that I was laughing about because it involves Lindsay in London from last week, and I was laughing. So when I first started nursing, we had this, this traumatic code. Somebody passed away suddenly. It was I guess considered a crime scene, at the yellow tape. Anyway, it was a little unsettling, right? And so anyway, time went by, and then as time went by, I worked night shift. The call light would go off in the room randomly. I'd be like, that's kind of weird, always. And so then
in the crime scene,
at the crime scene in this room, the call light would go off randomly, and just weird things would happen. You're just kind of so then I finally kind of said something. I'm like, I think are we did this patient leave the world unsettled and they're haunting the floor now? Got to the point that I wouldn't even take patients in the room. I'm not kidding. And then things would happen
room.
Yeah, seriously, in the where you the linen closet or the stocking room, weird things would happen. And then I remember one day sitting there charting, it's 2 a.m. and this wheelchair just wheels by.
Get out of here.
I'm not kidding. I have it on video, and I'm like, oh my gosh, it's the patient. Literally, I was like, she is trying to tell us something. It became such a thing. No, it was my freaking coworkers messing with me for months.
No way.
Literally, it was fishing
awesome.
wire. And I was finally somebody let it slip. You guys, this kept me up at night. Thinking that this
PTSD.
Patient literally needed to tell us something. Needed to I don't know. You run up,
and you're so empathetic. You're trying to connect with this spirit.
Yes, exactly. And I'm the full moon. And I'm things are happening. She's the call it, all the things. And then the wheelchair was my last straw. I'm what is happening? It's just wheeling down. No, it's my freaking coworkers.
That's
so
awesome.
I always just laugh because I'm that's classic, in the hospital. I'm I would feed into that. And just still to this day, I laugh. I'm yeah, I thought that place was haunted. So
there's got to be something to it. There's no OR 13.
Yeah, there's nobody ever puts level 13 on the elevators.
Yeah, it's
we don't have an OR 13.
It's superstitious.
No, it goes from 12 to 14.
You guys, I didn't know that.
Yes.
I mean, I knew they had that on buildings and floors and things.
I'm just saying.
There's no OR 13. Okay, but we are superstitious.
I wouldn't want to operate an OR 13.
Really?
Give me 12 or 14.
Okay, but also there are are things that I'm like, you call us crazy, but
I
we
would
have
do
been
it just to
proved
prove
right.
everyone
things
wrong.
come in threes. Nights are worse on full moons. Like I'm like,
It's a real thing.
it's a real thing. I'm
Yeah,
like,
for sure.
I'm like,
All right, you're
I'm
not totally
superstitious.
crazy.
Like,
Okay.
I'm a little stitious.
I love that they did that though.
That's awesome.
So yeah, that's like a story that I was like, you know what? That's actually kind of a funny one. Because I
love
look
it.
back and I'm like, I cannot believe like baby nurse Whitney just really was
You're
like,
all in it.
this patient is just, she's trying to tell me something. Like, yeah, it's fine.
That's funny. Okay, well, Tyler, what'd you learn today? What do you think?
Well, I learned a lot of what I already knew. Whitney is awesome.
Oh, thank
awesome at what
you.
she does.
No, that's nice.
She's a great energy. She's a
super
great
nice.
support to the community, and I know
Thank
she's
you.
doing excellent work and
Thanks.
helping many people.
You guys are nice.
You and Dr. Brock are like the dynamic duo.
That's
so
super nice.
We appreciate you and all that you do. And
Well, thank
I
you
think
for your guys' help. Like,
well,
you guys help so much. Like, truly.
That's
so
easy.
thank
That's
you.
easy.
I don't
Easy to be
remember
friends.
doing anything to help.
Yeah.
Okay,
But
Tyler,
thanks.
chatting with me in the mornings. Come on, yeah. No, you're like you guys have been very helpful.
Good.
Just being like, you're gonna make it. You're gonna be okay. You're gonna
Yes.
learn this stuff. Like,
We can empathize with one another for
yes.
sure. So yeah.
Just seeing Alex's face wave as we're doing surgery as we
Through
walk
the window.
by.
Yeah. That is always fun.
Yes.
Well, how would somebody connect with you, Whitney, if they wanted to follow up, get to know you, had more questions?
Yes, they just come to clinic. Like,
Yeah.
come to
Where's your
and
clinic? Where are
see
you at?
me. I'm at Utah Valley. I'm in the Physicians Plaza, 4th floor. So they can come see me there.
Intermountain Neurosurgery at
Intermountain Utah Valley
Hospital?
Neurosurgery.
You heard it. She just cleared it. Open door. Come
Yeah,
in when
open
you
door.
want.
Come and see me. Come
There
and
you
see
go.
me. Even if you just want to chat,
Yeah.
like, just
Perfect.
come and see me.
Love it.
Well, our clinic, you can connect with us. Our YouTube channel is the Summit Medical Institute. Our Instagram is Summit Brain, Spine, and Orthopedics.
Huge fan of it. Follow it all. You
I
guys are
love
doing
it.
good
Love it.
work out there.
And always, we like to see people in person. Tuesday morning, 7 a.m. at the Mountain Point Hospital in Lehigh for our in-person multidisciplinary case discussions. This has been another episode of the Many Minds podcast. Oh, I got to backtrack.
Yeah, dude.
I skipped a piece.
Shout them out.
Shout out to our production team.
Oh, yeah.
We always appreciate what these guys are doing
Yes,
for us.
Thank you. Thank you.
Make me look good, all right?
Sound good,
Yeah,
look
make us
good,
look good, please.
do all the things. Where was I? Finishing up. We're wrapping up.
We're
All
wrapping up.
We appreciate everybody that's listening. Leave us some comments and feedbacks. Let us know what you like, what you don't like. If you want to come chat with us, we'd love
Reach
to hear
out.
from you. Come out and spend some time with us here on the show. We always are interested to hear everybody's story. I'm excited for the ones coming up. We've had a couple good ones recently. I think we're looking forward to another good ones. Oncology, general surgery.
Oh, this is awesome. I'm
We've got-
excited for that.
Yeah, we've got some really good ones coming up, so
Good.
stick with us.
Yep.
This has
It's a
been
wrap.
another episode of the Many Minds podcast. Many Minds for better outcomes. We appreciate you. We'll see you next time.